به شؤون علمية وبفكرة وأتوقع وسنعمل على إحيائه إن شاء الله مرة أخرى. هذه المحاضرة هي واحدة حتكون المحاضرة دائما في الأسبوع الثالث من الشهر، وهذه أول محاضرة، وحتليها محاضرة في أبريل ويكون المتحدث فيها البروفيسور عبد الباقي، ثم أخرى في مايو حتكون المتحدث فيها البروفيسور نعمات حسن أبو بكر. يشرفني اليوم أن نستمع للبروفيسور سلافة تلقيت حديثا للجنة الأستاذية بكلية الطب، وأعتمد في هذه المحاضرة على عكس ما قامت به من نشاط وأبحاث أهلتها للتربية للدرجة الأستاذية بجامعة خرطوم، ونتمنى أنه يعني تستمر محاضراتنا ونحافظ عليها حتى تعين الفائدة، وحتى انه ينشر يعني الابحاث الكبيره اللي يقوموا بها الاساتذه في مجالات مختلفه. فنرحب بالبروفيسور سلافة، تفضلي. شكرا لك.
بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. الأساتذة الأجلاء، الضيوف الأعزاء، إخواني وأخواتي من الأسرة وأبناء الطلاب كذلك، أرحب بكم جميعا في هذا اليوم. إنه حقا يعني يوم سعيد وأنا أتحدث إلى هذا الجمع الكريم المتفرد. يعني كثيرا ما تحدثنا في محاضرات للطلبة ومحاضرات للزملاء ومحاضرات في المؤتمرات، ولكن هذا اليوم يوم تاريخي كوني أتحدث مع أخواني وأخواتي من الأسرة وأساتذتي الأجلاء كذلك. فأرحب بكم وأستمعكم عذرا، سأتحدث باللغة الإنجليزية ولكن سأترجم معظم المصطلحات، وأتمنى أن تشاركوني هذه التجربة المتواضعة التي سأتحدث إليكم عنها، وهي تجربة إنشاء تخصص طب قلب الأطفال في السودان. والحق يقال فأنا لست التي أسست هذا التخصص، ولكنه كان موجودا منذ السبعينات، وأتوقع أن يأتي أستاذنا الجليل أستاذنا بروفيسور السيد عبد المنعم السيد. بروفيسور عبد المنعم السيد منذ السبعينات أنشأ هذا التخصص، يعتبر من الرائدين في هذا المجال حتى في المنطقة العربية. وكذلك أتى قبل للسودان أستاذنا أو زميلنا دكتور الفاتح أبو زيد، وهو من القلائل الذين أتوا قبلي في هذا المجال. فالحق يقال مذكوركم بالخير، وأشارككم في هذه المحاضرة how we managed to establish this program in Sudan. وقبل ذلك أهدي هذه المحاضرة وكل أعمالي إلى أسرتي الصغيرة وأسرتي الكبيرة، ومن وقتهم الثمين تمكنت من أن أقوم ببعض هذه الأعمال. وهذه الرسمة تقدمت بي ابنتي الكبيرة آلاء، رسمتها لي this morning وهدتها لي بمناسبة هذا اليوم، فأشكرها وأتمنى. My professor was really my father. He was a model father, and he always encouraged us how to go into science and how to be hard workers. فله رحمة ومغفرة. وأفتكر من الحاجات الجميلة إنه دائما كان بيدعيني ببروفيسور سامو، يعني that was his favorite name. There are people in this life you meet only once in your lifetime. I am very proud to have with us here Professor Muhammad Ahmed Abdel. He taught us how to go into the specialty of pediatrics, the specialty of treating children. Really, we went through him and we learned from him a lot of things, science, ethics, and how to go about learning. So, and after graduation, after we sought our specialty in pediatrics, that is the medicine of children, we were really interested in finding a specialty to satisfy our own ambition ambitions and as well to help our people. So I was really searching in Sudan and asking our colleagues, what is the missing thing in Sudan? And immediately I found that heart disease for children was not well served in Sudan. In fact, this was not my interest. Cardiology or heart disease was not really my interest, but it became my interest when I realized that we do need it in our country. And at that time, I was writing to many people asking for training posts in this specialty. And luckily, this gentleman, my Godman, he was in Scotland when I was writing, asking for a training post in UK. And in fact, the man was coming to Kingdom of Saudi Arabia to establish this center, King Abdulaziz Heart Center in Riyadh. So when he answered me, he was in Riyadh. He phoned me and he asked me to come for an interview to give me a post in Riyadh. And he said, would you mind if you come in Riyadh instead of going to UK? I said, of course I don't mind because my family is in Riyadh. And his first question at the interview was, Dr. Solafa, why do you want to learn pediatric cardiology? And the answer was, I wanted to do it in order to come and establish the service in my country. And that was the secret. That was really the secret. SubhanAllah, this is why maybe God facilitated all this problem. And in fact, learning in order to help made it very easy for me to do it. So I spent 5 years in the center. In that time, I managed to learn pediatric cardiology. That includes echocardiography, ultrasound of the heart, and how to do cardiac catheterization, that is al-qastra al-qalbiyya. And also I got the fellowship of the center in that specialty. I managed to get another fellowship from UK. And so at that time, at the time of departure from the center, in fact he called me and he said, Dr. Solafa, now you are more than ready to go home. So I said, of course, yes, I want to go home. My colleagues were surprised. I said, it's too early for you to go home. I said, no, I think it's best to go home now and start there. And I have to say the center helped us a lot. It did not help me personally, but it helped our country. We really appreciate that this center, where I had this collection of people with different expertise from all different parts of the world. The governor was from UK, we have Dr. Dupisi from South Africa, this doctor from Australia, and a collection of people with different expertise that I learned a lot from them. Actually, I think I learned some wisdom rather than science. Because in our practice, you do need the wisdom rather than the science. And then home at last. The thing to do at home was how we can establish this program. How can we bring this technology into home, and how easy is that going to be? It wasn't easy at all. It was very challenging. We need to establish all these pillars. We need to establish the service itself by initiating clinics, initiating echocardiography services. We need to establish cardiac catheterization for children, to establish, to help and communicate with our surgeons, and to help in establishing intensive care treatment for children. Communication was highly needed. Training was a very important part of the program. And prevention, to work at tertiary level at the same time, not to forget the primary level. And also to support the patients. The patients are poor and they need a lot of support. And also to go into research, because by doing research, you prove yourself, you are more known to the international community, and then you get more support. It's not really research for your own self. So we started by trying to recruit a team. I'm very proud that all my team members are here, and I appreciate their help and support to me. And we recruited the young people, residents and fellows and registrars, to be part of the team, and we started training them. At the same time, we increased the number of clinics in town by making more clinics at the Sudan Heart Center. This is where I started to work, and I'm still working there, the Sudan Heart Center, and also we initiated other clinics at SOBA. We immediately realized that SOBA is our reference hospital. We really need to upgrade SOBA, and we need to try and move the technology to SOBA. the clinic there. This is the Soba clinic here at the bottom, and this is the heart center, and this is Jafar ibn Auf. Jafar ibn Auf is the largest children's hospital. So we initiated many clinics there, and we started training our young staff. We were not really interested in the number of clinics only, but we were quite interested in improving the quality of services given. One of the big problems here, for example, ultrasound of the heart is a very important specialty. Here, Mujab is and it has a certain protocol, it has methodology, it has international standards. So we were very interested that these clinics should be run with the international standard, not only subjective assessment of patients. So we were very keen that these echoes should be reformed. They should be done with the standard normalization, normal standardization values. So we made these echo manuals available in all our clinics to encourage the young staff to use them and not only to do it as. This was a paper published in Sudan Medical Journal about how to do echocardiography as a quantitative and objective with objective methodology. And I think it is very important to do this. Then the specialty of cardiac catheterization is a very challenging one because it is invasive, it needs anesthesia, you need takhdir, you need to go inside the heart of the patient. How are we going to do that? We need a very big team. So let me speak to you a little about this technology. It is a technology I'm sure many of you سمعوا عن القسطرة القلبية. أكثر حاجة بتتعمل للشرايين في الكبار. في الأطفال still we need it لأن الأطفال عندهم عيوب الخلقية، عندهم ثقوب داخل القلب. القسطرة القلبية صارت الآن مرجع لتقفيل الثقوب القلبية، فهي بديل للجراحة. إذا تستحق التعلم. So when we learn something, we ask ourselves, are we learning the right thing? Yes. We are going to help people? Yes, we do. So this is the cardiac catheterization. So you can use saddadat. This one is showing the saddada. This thing is a metal, but it can come all along this tube, which is al-qastara. This is the tube al-qastara, and it can come inside it. So when it comes inside, then you can introduce it through the vein, بالعروق الأوردة. You can introduce it, and then when you reach the place where you want it to be, you can release it. تفتحها في المكان اللي المفروض تمشي فيه. But this was very interesting specialty, and we thought, why not to try and work on it? And this picture is very interesting, three-dimensional echo, showing the hole. That is the hole here in the middle, and this is the hole after being closed very effectively using this occluder device. So in 2004, we find that there are some cardiac catheterization. It is done by our adult cardiologists. But it is a very big difference between doing adult and pediatrics. The pediatrics, the children, they have very special forms of diseases and they need special training. So we try to do that. We try to build the team up. And right now we are doing about 150 procedures per year. Most of these procedures are intervention, treatment, rather than diagnostic. So we are doing closing defects, dilating valves, and sometimes other procedures. I'm going to share with you some of these. I'll take you through it. In this top picture, you see how this device is inside the catheter. It is pulled inside the catheter, and when we go to the place we should be there, we start to release the device little by little. You can see the device coming out until the first part of the device comes out. Then we pull it. We do this under X-ray screening. So we are looking at the X-ray and watching ourselves there. Then we pull this and we release the second part of the device. And then at the end, you unscrew the device from outside the patient and release it and pull the catheter out. So this is how it looks. After we pull it, we release it, and the catheter is out. This device will stay in the body. The blood will grow over it and cover it, so it becomes part of the body, and there are no reported problems. When the procedure is successful, that's it. It stays forever, and we discharge the patient after a couple of months of follow-up. So it is very rewarding because by doing this, you to avoid a major heart surgery. The heart surgery is a lot of complications, and by this procedure you avoid. This is another example of the heart. This is a small baby, a few months old, and he has severe stenosis of the valve, the pulmonary valve. تضيق شديد في الصمام الرئوي. So we introduce the same procedure, and this catheter is a balloon catheter. After we put it through the valve, we started dilating it. By that, the valve will be dilated, and we avoid open heart surgery. The alternative to this is to open the heart, and this has a lot of complications. So why not to take this technology to solve hospital? We wish that. So hospital right now there is no cardiac intervention, there is no cardiac catheterization. So in 2005, we thought we really like to transfer this knowledge and practice to SOBA. So we have written a proposal for a comprehensive cardiac center, and we call it SOBA Heart Center. In fact, we started very practical steps. There was a feasibility study done for this project, and some funding raised, and even the shi'ar, the logo of the center is here. But as you know, you need a lot of support. We are speaking about millions of dollars. So I really urge the university administration to really put a lot of effort in SOBA. I tell you, most of the people practicing cardiology and cardiac surgery in Sudan are University of Khartoum staff members. But we are not practicing in our center. And this is a very interesting example. This baby was born in SOBA on one Wednesday morning. It was Wednesday morning, that was our clinic on that day. So after the baby was born, he was very blue. So they called us to see him. And in fact, he needed an emergency procedure. So I called my assistant, Dr. Lelis is here, and we did that procedure by the bedside. And the baby now is 4 years old. He's running around and very well. So this is an example of how we can save lives. It just needs to concentrate on SOBA, because SOBA has all the infrastructure. The nursery is there, all the other specialties are there. So we need also to communicate. Communication is extremely important. We communicate with ourselves, with our near people, and with people around us, locally, regionally, and internationally. And only with this communication we manage to do this here in Sudan. I wouldn't do this myself. Our team plus the neighbors and the friends. So we have so many friends. When we write to them about Sudan, they come. People are very interested to come and help. You will be surprised how many people call us each day asking for it that they like to come and visit Sudan. And if we manage to encourage them and to coordinate these visits, it can be very, very fruitful. These are some examples of many people who come, but I like really to mention Dr. Muhammad Nu'man, because he is the one who trained me. When I came from Saudi Arabia, I came with some training, but I increased my training when I have my own patients with help from people like Muhammad Nu'man from Qatar Medical Corporation, and also my colleague Dr. Mehdi Tawfiq. He's Sudanese and he was in Leicester at that time in UK, and now he is in Doha. And right now, Dr. Tawfiq is operating in Medani Heart Center. He is doing some heart operations there, and I am supposed to be there, but I apologize because of this lecture. So they are helping us. We get a lot of help. The help is for the patients, for us, for training, and also fundraising, because these catheters are extremely expensive. This is the bad thing about them. They are very expensive. One operation costs a lot of so much money. But we have charities, and the charities are willing to pay if you show that you are serious. So the charities from Qatar brought something like more than $500,000. They come carrying with them the devices, the accessories, and the experienced operator as well. So we managed to treat so many patients. But really, dear audience, the communication is not only physical. Nowadays, with the advent of technology, the internet, and all the technology of the computer, we can communicate easily with each other through the net. And this communication is simple. By emailing people, you can get help. This boy is a very interesting story. He's 10 years. He can't play football. When he is about to another very nice example. This is Dropbox. I learned this program a few months ago. One of my friends in other medical corporation, he said to me, just put the echoes of the patient in this program. It can carry a large number of megabytes. And the echocardiogram of the heart is very heavy because it is moving. So we put the echoes, they review it, and they accepted so far 15 patients for free. This wouldn't come only with communication and with using the technology. We spend half of our time seeing the patient, half of them on the computer, looking for where the patients can be treated. So really, I urge my students, I really urge you, the young people, Amal and all my students, to use the technology for the sake of your patients. It's very, very easy. Also, the technology and communication have allowed us to train our young staff in Malaysia and some also here. So we have that facilitated our lesson. Having to go on training with two fields that if you don't train, you are in trouble. You cannot work alone. You need the team, and the team needs to expand, involving the states, not only in Khartoum. So we, alhamdulillah, with the help of Dr. Khalid, we managed to initiate the training program. And now it's 1 year old. We have our fellows in the program. They are with us here. We took 3 fellows, and these fellows are now completing 1 year for a diploma in pediatric cardiology. Actually, I got phone calls from Saudi. Some of our Saudi colleagues, they said, "Oh, you have this training program. Can we come over?" I said, "Oh, we are still very busy." I mean, because it is not easy to speak about the program and our level, because even some people are resisting the idea. But I thought, let us learn it and teach it. I think at the end we will get something good. Courses and workshops are extremely important for the training program as well as for other colleagues, pediatricians and residents. Talking to each other, my dear audience, is extremely important. Sometimes we work in isolation. Believe me, if you work in isolation, you lose your knowledge. So let us talk to each other. Meetings, service meetings for the patient's sake. If that is official meetings like the surgical meeting, we have to meet with the surgeon. We don't allow our patients to go for surgery, for a major operation, without discussing with the surgeon beforehand. And I tell you, it looks very simple practice, but sometimes it's not done. And if it is not done, the patient goes into trouble. So talking to each other for service as well as for education, for exchange of expertise and knowledge. When you talk, even if you talk to yourself, you learn something. So we are insisting that we should really go into meetings with our other cardiologists, because they face a lot of patients, other patients, but they have congenital heart disease. It's a very rare specialty. So sometimes the patient has passed through 5 or 6 doctors before he comes to you. So instead of the patient taking his papers and walking, we meet and we talk and we let the patient relax and we call him to tell him the result. This is very rewarding. And we managed also through this communication with our colleagues in Saudi to bring them also to visit us. They came and they did nice workshops, updating pediatric cardiology for our residents. Now talking about prevention, even though we are working at the tertiary level, we realize that if you put some effort on primary health care, then you gain a lot. And we spend our time treating the complication of simple, preventable diseases. So we spend some time, and we, in collaboration with our colleagues abroad, trying to find a program for this disease. It's a very devastating disease, rheumatic heart disease, رطوبة القلب. The disease is a sore throat, and then it becomes something very serious. The heart is completely destroyed. So, by putting simple program, we can control this disease. Actually, in Sudan, the last program ended before 2000, 1999, 2000. So there's no control program, active control program in Sudan, and we're very insisting to try and write the program with the help again of my professor, Dr. and my colleagues in the Sudan Heart Association. I'd like to read them. Dr. the president of Sudan Heart Association, and also our colleagues at the Sudanese Association of Pediatrics, جمعية أخصائية الأطفال السودانية وجمعية أخصائية القلب السوداني. These two societies really were great assets. They helped us a lot to take brochures and manuals of the program that has been printed. The program is very simple. It depends on raising awareness about how to prevent this disease. So just sore throat treatment and you are safe. So we actually were very interested to involve the students. The students are a real treasure. When you talk to them about something like this, they are very enthusiastic and they took this message and they distribute it in the distant villages أثناء الخواطر العلاجية. They go to very small villages like Bara. This group of students last year, they went to Bara area and they distributed the brochures to the schools and to the mosques and to the public, and that was very useful. The messages are very simple and they just need to encourage the students to go into community-based activities. Patient support. It's very interesting. We as doctors, our relation with our patients is a very unique one. It is a very unique one. Sometimes I tell my students, it's very simple. Put yourself in the position of the patient. If you do that, you can really appreciate how he feels. And what are we going to do? So sometimes these ethical questions are difficult to answer. Why don't we seek help from our advisors? I remember very well in 2004, I took my papers, ومشيت معايا كانت assistant دكتورة نهى. We went to مجلس الإفتاء. والحاجة الجميلة في مجلس الإفتاء كانت لنا تطبيق بقيادة برئاسة بروفيسور حسن أبو عايشة. وجلس وقرروا الخطاب حقنا. It was very interesting. How can we deal with this? This is an ethical question. Because when the place I came from, 30 people sit and discuss one case for 1 hour. How can I make a decision? I sent for few people and they gave us actually very interesting control. So these are difficult ethically, and we have, even in ethical questions, you have to get the maximum advice before you advise the patient. It's very difficult situation. This is why I said wisdom is very highly needed. Supporting patients also, actually here I am enlightened and I inspired by تجربة أستاذ البروفيسور محمد. And he is the one who advised me, why don't you make your own for pediatric cardiology, make and share a society, a non-governmental organization, منظمة أو جمعية خيرية. And that was having also again the help of Professor Abdul Steve, this is photo. I'm sorry, he didn't come yet, he didn't catch up with us. But Abdul helped us a lot to share the society. Now it is relatively good, it's working. We have a website under construction here, and we have our Facebook page. We encourage the parents to go in the Facebook and communicate with us. And we do have some little calls sometimes from time to time. Also, I saw the most difficult moment is when you tell a parent that your child has heart disease. It's a very difficult moment. By translating the diseases into Arabic and giving some information to the parents and to the patient himself can be very helpful. Like, for example,